Moving forward, the FDA will adopt the following COVID-19 vaccination regulatory framework on the basis of immunogenicity, proof that a vaccine can generate antibody titers in people. The FDA anticipates that it will be able to make favorable benefit risk findings for adults over the age of 65 years and for all persons above the age of 6 months with one or more risk factors that put them at high risk for severe COVID-19 outcomes, as described by the CDC. Well, they're saying that the data we've talked about, where you've got a vaccine and potentially you want to improve upon it. So hey, we made a little bit of a change. Maybe there's a new variant. We're going to do this. Well, look, we got higher antibodies, higher neutralizing antibodies. Is that going to be the data? And they're basically saying, like, only if you want that to be, are you ready for this, licensed, approved. I'm not talking about recommendations yet, but licensed or approved, we're only going to give you that for 65 and up. We're only going to give that for people with risk factors. We're not going to actually allow for licensing. For all healthy persons, those with no risk factors for severe COVID-19 between the ages of 6 months and 64 years, the FDA anticipates the need for randomized controlled trial data evaluating clinical outcomes before biological license applications can be granted. So let's pause there, Vincent.
Daniel, what if people want, someone's 40 and they want a vaccine? Why can't they get it? This way, they're not going to be able to get it at the drugstore and their insurance would pay for it. I don't see why they have to do that. Take it away, whereas we've been using them, and then to take it away doesn't make any sense.
So this is the deviousness. This is the underhanded thing that's happening here with smiling, happy faces. Is they start off with figure 1 in this paper where they talk about vaccine recommendations according to age and risk. And they talk about recommendations, in Australia, Belgium, Canada, all the way, through the EU. But they're not talking about recommendations. What they're talking about here in this change is Vinay Prasad and Martin McCary are going to take away access. It's not a question about changing recommendations, which come from the CDC, but it's about these two fellows sort of like, taking over and saying, we're not even going to give you a license. If you actually dare to give this to people outside of our, ideas, then you're going to be having to use this off-label, unlicensed, with all the risks that are attendant of not having that protection. And as you bring up, they're going to limit people's access because now the insurance companies, those big insurance companies that I don't think most of us actually like, just by the way, now they can deny paying for this. And so if you want this in the United States, you got to ante up. So I just want to point out, this is not about changing guidance. This is about limiting access. This is taking away access. So, we go to, in this paper, they sort of lay out this, and I'm sort of doing the figures at a point. They say if you're 65 and up, if you're under 65, but you have one risk factor, we'll go into that. We're talking about a third of the U.S. population. And so instead of saying, fine, and then for the rest of you, it'll be out there, but you make your own decision. We're not talking about mandates. They're going to take away the license. Like, it's not going to be licensed for you if you're, let's say you're 54 and you wanted, no. If anyone gives it to you, they're like, unless the FDA is going to recommend, well, they say recommend, but basically they're going to say, you need to do post-marketing randomized placebo-controlled trials, or we're not going to give you a license. You're not going to be allowed to market this. You're not going to be allowed to have a licensed product in the U.S.
Why? What's the downside if people want it, okay? I mean, the uptake has been low, as you have pointed out many times, right? But if there are many people writing to us who want this, and how many kids have died of COVID? Maybe some parents want to protect their kids. So this doesn't make any sense. It's just these two guys who, by the way, have no experience in infectious diseases or virology, have made this decision, which is typical of this administration, right?
Well, I think that's the part that's scary. It's traditionally what would happen is you get a group of experts together. You spent your years studying vaccines. You know about this. Maybe you're infectious disease. No, we're not going to ask the experts. We're not going to have them weigh in. We're not going to get the public to weigh in, kind of get a sense of what's going on here. Just these two fellows have now been given basically, the power to restrict our access to products that most of us want. Most of us want access to. I mean, as we saw last year, not everyone gets this vaccine, but we want to know that if we want to get it, we don't have to go to, I don't know who we have to go to, and then like go through this CDC list of underlying medical conditions and find something on the list and say like, yeah, I'm a little heavier than I'm supposed to be, or I'm physically inactive, or there's this smoking current informer. I don't know if I get to say like, my dad smoked a pipe, and I smoked a pipe when I was in high school I went through a phase. Can I get the vaccine because of that? Or what are you supposed to like, divulge like your medical, your private medical history when you go to the pharmacy? I mean, this is really crazy.
Daniel, the other thing that's annoying is that in the press, this would be done by a committee, right?
Normally it's a committee. Normally you don't have an oncologist or a surgeon. Academics, I don't even know how many patients they really see when you look at what they've been doing for a living. Vinay Prasad talks about, well, his patients, they benefit. They should get the vaccine, but other people's patients, he's not really sure that they should have access. I'm like, excuse me? Like, so your patients can have this, but my patients can't? What about all these people with long COVID? And they really want that protection. I don't see a history of long COVID or chronic fatigue or a lot of these other things in the list. Really horrible. So there's an article on this topic, FDA, Ways to Restrict Access to COVID Vaccines by Christina Jewett and Apoorva Mandavili. And I'll read a couple of the quotations. First, they've got this Dr. Daniel Griffin, a physician in New York. He claims to have treated thousands of COVID patients. And he says, I think that changes like this will lead to more unnecessary deaths. What they're really doing is they're very slowly reducing vaccination in the country. This doesn't preserve people's choice to get vaccinated, says Dr. Denise Jameson, Vice President for Medical Affairs at the University of Iowa and advisor to the CDC. In this article is something that will surprise most readers and will need to be ignored by those who are still sticking to the line that COVID is not a big deal in kids. I just want to point out in this calendar year where they ended in August, the CDC reported, it's 150 additional pediatric deaths due to COVID. That's during Omicron. That's when, quote unquote, it's mild. I just want to remind people, we've had over 1,000 deaths in children from COVID. And we keep adding to that number. We see thousands of hospitalizations, in children. We see tens of thousands of hospitalization in adults. We see all these people still developing long COVID. These are all things that vaccination can prevent. And so I just want people to realize that here we are seeing the happy, smiling faces as they take away our access.
These vaccines were licensed for 12 and up, right? There's no scientific reason to take that license away at this time. That's the bottom line.
Yeah. I mean, that's really what they're talking about here. They're not talking about, and I think it's really important, they're not talking about changing recommendations. They're talking about removing access.
Yeah, and the previous decision was made by a committee, and these guys don't agree with it. So that's it, because I'm sure if 12 people looked at this, we would have a different outcome.